It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hello everyone and happy early Mother's Day. Welcome to this edition of Top Docs of Houston, where we feature some of the best doctors in the Houston area that are changing people's lives. I'm Dr. Nina along with Jim Knox.
That's right. This is the place to go to find some of the best doctors in the Houston area. And we're going to kick it off with one of the top bariatric surgeons in the Houston, Texas area. That is Dr. Robert Marvin.
Charlie's weight was 380 pounds with a body mass index of 58. So, I mean, he's clearly in the high risk group. In fact, anyone with a body mass index over 50 is considered super obese and has an even higher risk than our average patient would have for developing problems.
My wife and I did a lot of research when I decided to have weight loss surgery. And I chose the sleeve mostly lifestyle reasons.
Really what the operation is based on is changing the stomach into a narrower tube like the esophagus or the small bowel.
The recovery for my surgery, Dr. Marvin tells his patients up to 3 weeks to return to work. So I took the full 3 weeks off. I had the time to take. I probably could return to work after 5-7 days.
In modern society, we just don't need a stomach that we've been provided with. Whether it was evolutionarily necessary to be able to store a lot of material at one time because humans or pre-humans were not eating very often. But with the way our society is now, we simply don't need that much stomach. For some people, that becomes the pitfall. The capacity's there, and it generates the extra hunger that's just not necessary anymore.
You know, it is a complete lifestyle change. The day I came for my very first weigh-in, I weighed 429 pounds. Today I weigh 265.
These operations provide the best chance of curing diabetes there is. People with diabetes generally go and see an endocrinologist who will try to control the blood sugar with medications, but that doesn't make the disease go away. Having a gastric sleeve, or particularly a gastric bypass, the cure rates are high. A gastric bypass, the cure rates for diabetes are probably 80%, 85%, maybe higher than that.
For the sleeve surgery, they say the average patient can expect between 45 and 83% of their excess body weight to disappear, go away forever. I had surgery, day after tomorrow will be 6 months ago, and I've already lost 63.6% of my excess body weight. I sleep much better, I feel much better, you know, I mean, everything's just so much better.
I had 2 children and I nursed them both, and my breasts were completely saggy and gone.
Aisha came to me after she had 2 children. She was interested in improving the appearance of her breast after breastfeeding and childbearing. They had lost some of the fullness, and that typically happens after giving birth.
I simply wanted to go back to the way I looked before I had children. I didn't want to look unnatural in any way, and he completely understood that, and he had a very good understanding of what both me and my husband wanted.
That's the most common question, is can they get that body back after children? They may not necessarily get that exact body, but we certainly can remove the extra skin, tighten up their waist, and give them that figure back that they had before.
The procedure went very well, and the recovery time was easier than I thought. I mean, I thought the tummy tuck, which I almost didn't want to do in the beginning, and I ended up doing, which I'm very happy with, was actually much easier than the breast augmentation. I was probably in bed for about 5 days, and then not really back to myself for about 2 weeks. But 4 to 6 weeks after that, I was completely fine, like nothing had happened. I felt great.
Typically after Having children, women have extra skin and some fat along their tummy as well as on their hips. And this is, even with all the exercising, many people can't lose that weight. And so if they've completed their childbearing, that's the perfect candidate. With the breast, many times again, there's postpartum involution of the breast. So many times again, after childbearing, they can't reverse this effect. And again, that's a good candidate.
He was very, very nice. He was very applicable to my needs. You know, he talked both to me and my husband about what kind of results I wanted.
Someone who, like herself, who's very fit and wanted to enhance the appearance of her breast after childbearing, this was a perfect case for her.
And he was so professional and so nice. It was fantastic, fantastic experience.
Kimberly was born with a facial birth defect until she met Dr. Michael Eisemann. Now she's a beautiful young girl. To find out more on Kimberly's story and other life-changing stories, log on to topdocsofhouston.com.
The acne was getting bad. He was in football and it seemed to be getting worse, so I wanted, some treatment for him.
The chin strap would get really sweaty, so it would grow a lot on my chin.
When Jeremy first presented to our clinic, his acne was affecting his self-esteem. He was trying a lot of over-the-counter products that were helping somewhat, but he needed a couple different medicines added to his regimen to really get his acne under control. In teenage acne, we're not really going to cure the acne until the patient essentially outgrows it, but we can suppress it.
He's been seeing Dr. Perri about 2 months now, and he first started him on just a gel to use at night for a few weeks, and about 4 weeks later he added an antibiotic.
And so what we did with Jeremy was use a very good topical regimen that got rid of some of the very small acne lesions. And then we also used an oral antibiotic that helped with the deeper cyst acne lesions. And with that combination, Jeremy was able to achieve almost clear skin. And he's very confident and happy with how his appearance is today.
One of the things that happened since he started on the treatment is his self-confidence has improved, and he's feeling better about himself.
I recommend to parents with children who have acne to bring them into a board-certified dermatologist so the appropriate acne treatment regimen can be tailored for that patient. There's a lot of good over-the-counter medicines out there, but sometimes prescription medicines need to be used. And sometimes a dermatologist just needs to get you onto the right over-the-counter medicines and get a good skincare regimen for your patient's skin.
The appointment scheduling is really flexible. They have same-day appointments, and they also have extended hours, so he doesn't have to miss school when he needs to come in, which is a plus.
I love what I do, and I want to convey that to my patients and have it become a very pleasant experience when they come to our office. And one of the ways we do that is we try to minimize wait time, where most patients are seen immediately at their appointment time, as well as patients can come almost whenever they would like to.
I would recommend Dr. Perri and all the things he does.
Are you having trouble sleeping? Do you wake up rested? Sleep is important. It's a time when we consolidate memory, we resolve conflicts, and we rest those aching bones and muscles and help our mind get back to normal from the wear and tear of the day before. So what's the best way to get a good night's sleep? First of all, avoid caffeine after 5 or 6 p.m. in the evening. Avoid alcohol near bedtime. Although it may make you feel sleepy, you're not getting quality sleep when you drink alcohol. And you're also not getting all those things about consolidating memory and resolving conflict when you drink alcohol to help you get relaxed to sleep. There's lots of medications for helping you sleep. However, the prescription medicines are ones that should not be taken on a regular basis. They can become a little bit habit-forming. Some of the best medications for being able to sleep are the antihistamines that you can buy over the counter. There's many brand names and they work in a wonderful way. Plus, you don't get addicted to them. So have a good night's sleep. Don't snore too loud, and exercise regularly. That'll help you sleep a lot better.
I was pretty sick, and I'm usually a very healthy person as far as just normal activity level. And I had experienced a lot of shortness of breath and I ended up being quite sick, but I didn't know it. And my primary care physician did some blood testing, and she found out that I had some allergy antibodies. So she referred me to Dr. Dickens.
So what we found out when we did additional blood work was that she did have a virus and several other problems, including a vitamin D deficiency, which is very common in allergic people. And we wanted to get her healthy from that before we moved on.
Of the 64 things that they tested, I probably showed up around 40. I had trees, mold, dog, cat, grasses. I was just amazed that so many things, because I love being outdoors. It's really quality of life. I expect to be able to get out and be active.
But one of the things we do as allergists, even first and foremost, is we're immunologists. And an allergy is an abnormal immune response. So we look at the whole patient and we try to make sure that we're not ignoring something, be it a chronic sinus infection or a chronic virus or something of that sort.
Since I've been treated, I think this is the first spring I haven't had a sinus infection. And I didn't realize why I was getting sinus infections, but I'm pretty sure it was the allergies.
In this part of the world, in Houston, we have just about everything. We have a lot of different allergies, and mold is a major problem. Probably not everybody needs to be skin tested, but certainly if they're having symptoms that are making them have a decreased quality of life, they're congested, they're feeling bad all the time, and they're attributing it to either their chest or their nose, definitely they should be screened.
I want to stay on my routine. It's working. I don't want to drop off of my singular or just take it for granted, because I am having my health has improved a lot, and I notice other people are struggling, and I'm just so glad I got in here before the spring allergies really hit. I appreciate their professionalism and helping me get my health back.
Now don't forget, for more life-changing stories, please visit the website, topdocsofhouston.com.
That's right, that's the place to go to find some of the best doctors in the Houston area. Right now, Dr. Nina, the place to go is our next top doctor. It's Dr. Saqib Siddiqui going over spine surgery.
Aaron's a gentleman in his 30s who'd had several years of spinal pain coming from his neck. So he had pain in his neck radiating to his shoulders and upper extremities. And at that point, we had diagnosed him as having degenerative disc disease in the cervical spine at 2 levels.
Imagine walking around through your day in your head never being in a place of rest, and you're constantly hurting. And then you think, okay, it's bedtime. I didn't look forward to laying down and going to bed because it still hurt.
So he underwent physical therapy, he underwent some injections, and just the passage of time and taking medications. And over the course of 2 to 3 years, he decided that his symptoms had become severe enough and were no longer responding to what we call non-operative treatment.
Never during that time did he ever say, you need surgery right now. You need it right. If you want to be fixed, you need surgery. You need to go have surgery. Never did that. Those kind of things, not pressuring me, letting my body talk to me, let me know when I was ready. It let me know that he cared.
We offered him fusion of the cervical spine at 2 levels. So fusion means, for example, in this model, that this bone is fused to this bone, and that's called a fusion. So there's no motion here. And hopefully what that does is it eliminates the pain.
The first time I actually laid down without pain, I was excited. I was super excited. I couldn't believe it, because I could never find a point of rest before that. So that's when I was really, really happy about it, and I knew that it worked.
That's one of the more satisfying things about doing what I do, is to hear the positive stories of how the surgical treatment positively impacted the lives of various people. And yes, we do hear the comment quite often that, I don't know why I waited this long to get this fixed.
He said, just don't put anything on your head or carry anything on your head. He said, help me with that. He said, just use common sense. And he said, you can resume your everyday activities. The very next day I was golfing. I just appreciated that, him taking his time. And the end result was just perfect, and it was great. I feel awesome.
I went to a previous fertility center and lost an ovary and tube from hyperstimulation, and that's how I lost 1 ovarian tube. I did fertility again and lost a child at 20 weeks.
She actually had an abdominal cerclage placed, which is basically a stitch at the cervix to try to keep the cervix closed. She then conceived on her own, but delivered early, around 33 weeks.
I had an ectopic after her and lost the other tube. So therefore it led me to, we wanted to have a second child, and that led me here to Houston Fertility Institute.
So she came with a uterus intact and a single ovary, no tubes. The goal with IVF is not only pregnancy, but a healthy pregnancy, and it's healthy mom and healthy pregnancy.
Worried about just getting one implanted, because he was real adamant. He's real adamant about the 1 embryo transfer, and I was like, well, what if 1 don't work? I want 2. And he was really, he was adamant about, due to my preterm history, he wanted to do a 1 embryo transfer. And I really felt that he was looking out for my well-being.
And obviously she's just a little wary, it's a lot of emotion, and it's a lot of time, and it's a significant expense that you want to maximize your likelihood of conception. But for me, given her history, the most important thing for me was to make sure that we get her pregnant, but get her pregnant with a singleton, just 1 baby, and then go from there.
They call you with the results, but I didn't get called. I was in the office, and I had an appointment that day, and she told me I was pregnant, and I was excited. He's been wonderful. He take you step by step. He explained everything to you.
And every patient that I have is, a little part of me is with them, and I hope vice versa, because I think we're able to change lives. We're able to change and hopefully help initiate families.
Dr. Meredith Morgan is one of the best physicians in helping women manage menopause. Practicing for over 35 years, Dr. Morgan, as you see, has a unique office. It's located in the Museum District, a freestanding facility with a relaxed atmosphere. Today's topic, perimenopause.
It's really important to understand that this is a normal process, and it happens with all women. It starts in their mid-40s, the average age of onset is 47, and on average it lasts about 4 years.
According to Dr. Morgan, perimenopause represents a change. Women will experience a number of symptoms.
This is a time of relative estrogen deficiency and brings on mind, mood, memory, and even sleep disorders and irregularities. Yes, there are hot flashes and night sweats that most women think of as menopausal, and yes, they can be just as severe as the postmenopausal ones. But the differentiation between transitioning and a non-cycling constant state is the unpredictability and uncertainty that can be so distressing to a woman.
For women experiencing perimenopause, Dr. Morgan outlines the next step.
We have 3 levels of management. The first will be basically lifestyle adjustments and home remedies. The second is non-hormonal medical prescriptions, and the third is hormonal management. We want to treat at the lowest dose for the shortest duration, consistent with what the need is. We have to understand it's important to use what is acceptable to the woman herself. In my mind, without a doubt, we've taken a step forward for the city of Houston and its surrounding environments. We've developed a site that is comfortable and convenient, that provides medical center quality with minimizing the hassle that's involved. It's been very rewarding to have done this for the last 10 years, and I'm looking forward to the next 10 and 20 years in continuing to do and help women throughout the entire region.
Kimberly was born premature, so we had quite a bit of time in the hospital, about 6 weeks after birth. And it was about 2 weeks into that there was some discoloration to her left cheek and her lower lip. And that later started to grow, and we found that it was hemangioma.
Kimberly was born with a congenital hemangioma, which is a blood vessel tumor. It involved the skin of her face, and it also involved deep structures as well.
Coming to Dr. Eisemann and him explaining that it would be a process, but there would be a time that we really wouldn't be able to look at her and know the starting point with regards to the growth.
You know, we basically like to tell them in advance what we're planning on doing, and in her case, it's a staged procedure, and it was planned just that way. If you're trying to do too much at one time, you know, it can even be dangerous as far as the bleeding is concerned. So we tell them in the beginning that we're doing as much as we can at that time, and we probably removed maybe 20 to 30% of it, probably the first operation, and she's had 5 or 6 operations since.
I was excited because after all of this, I actually look like this. At first it was a lot, like all around my face, but it was, now that I look back at it, I'm actually really excited and happy.
There have been times that she came in after surgery that from the point of entry, we would hear, Kimberly's here, Kimberly's here, Kimberly's here. And people would come out, you know, and just, hi Kimberly, how are you, Kimberly? And that means so much, and especially for an 8 or 9-year-old who's bandaged from surgery, you know, it just goes without saying that his office staff is so supportive and so caring.
It makes me feel nice that he cares, or that he has, like, that he is nice enough to ask me how am I doing, or how is life going for me now.
Well, it's changed her life, you know. I can't imagine her going on life the way she was before without having had surgery. I don't think she can either.
I would say that people don't stare at me or talk about me or anything like that. They treat me nicely, and now I just feel really excited or happy to see that I can do all these things confidently because of Dr. Eisemann.
To find some of the best doctors and the latest procedures in the Houston area, log on to topdocsofhouston.com. It's topdocsofhouston.com.
I had sinus pressure all in this area, all the way down to the jawbone, pain and swelling, and it wasn't just occasional, it was every day. I had been to about 8 doctors in the Metroplex. All of them had told me that there was nothing there, nothing they could do for me, and to basically go home, live with it, and for me that was not an option.
In Vicky's case, she presented to me with a history of constant headaches, chronic sinus disease, and had radiographic evidence of significant sinus inflammation. She had been treated with multiple rounds of antibiotics, nasal steroid sprays, and allergy medications with minimal relief.
My first appointment with Dr. James, he told me that he thought that he could cure me, that he thought that it was a balloon procedure that I needed. He explained that nothing is 100%. This might work and might not, but I feel like with your condition that you've got a great chance. So it's up to you whether you go for it.
Usually on the first visit, we'll discuss their history, how much of their symptoms are related to actual sinus infections and sinus issues, and how much of those relate to just allergies. And then that kind of determines what type of further evaluation or diagnostic procedures we need to do. And
he did the procedure within 10 days. I was pain-free, have had absolutely no problems since. And as far as I'm concerned, he's a godsend.
Within 24 hours of completing the surgery, her headaches had resolved and symptoms had improved significantly.
Dr. James has changed my life for the better because the activities that I pursue, I'm able to do my gardening, my housework, just general things, travel, any activities I want to do with my grandchildren, running, riding bicycles. I didn't have the stamina to do that before. Now I'm able to do even more because I am pain-free.
The typical type of patients that we see here are people who suffer from a significant amount of headaches. Not necessarily all migraines, but headaches of every different type. And what we try to do is figure out the generator of where the headaches are coming from and try to treat them more from the source.
My severe headaches were interfering with my long distance running. I run marathons and half marathons, and I wasn't able to train
for those races any longer.
Sometimes when there's a component of a spinal leak or even an increased intracranial pressure, it's very hard to pinpoint over a long amount of time exactly what it is that caused that problem. So in Catherine's case, we couldn't tell if there was a positional component or not because she just suffered from headaches 24 hours a day, 7 days a week.
Dr. Soren really took a holistic approach to identifying what my headaches were and providing a comprehensive treatment plan. So initially, he was able to relieve a very severe headache that had lasted 4 or 5 days by performing trigger point injections, which helped immediately relieve the tension and the pain that I was experiencing.
There's so much data now that has to do with migraine and increased risk factor for stroke. So if you have a patient who has a long-standing history of migraine headaches, we definitely want to get an image of their brain.
He's kind of empowered me to help manage the headaches on my own, and then I know that I can always go to him if I'm having an emergency situation and there's a headache that I can't knock out with the oral medication that he's given me to help treat it.
Based on her clinical symptoms, we devised that she had a low-pressure headache, and so what we did was we performed something called an empiric blood patch. And so what that means is that we will take sterile blood from her hand and knock her out, and instead of doing an epidural steroid injection, we'll actually use her own blood to form a clot over the area where the leak is coming from.
After I saw him, there were radical improvements in my quality of life. I went back to long distance running. I was able to complete 2 marathons under Dr. Soren's care, plus many half marathons.
Dr. David Kosmowski and David Carter have teamed together to create a state-of-the-art treatment for a medical condition called venous reflux disease.
Many patients are perfect candidates because the venous circulation has been found now to be the cause of multiple medical conditions, open wounds, swollen legs.
Venous reflux disease is an affliction of the veins in the lower extremities where the valves don't work and the blood goes backwards. Instead of going from your feet to your heart, it actually goes down towards your feet. Results in swelling, pain, discomfort, and then the more visible signs of varicosities, and it can all go all the way to where the patient actually has ulcerative disease in their lower extremity.
Now, if left untreated, venous reflux disease can result in dangerous blood clots and leg ulcers, just like one of their patients, Juan Gomez.
6-7 years ago, the wound on my left ankle, inside ankle, started opening up, and the skin broke, and it developed a wound, and it started getting bigger and bigger and bigger. I have to have it covered up because of the fear of getting some sort of bacteria on the leg. I could not go swimming, so I had to cover up the leg for over 6 years. I've covered it up with plastic bags.
Mr. Gomez, I originally met through my cardiac work. We actually did bypass procedure on his heart. But interestingly, that wasn't his main complaint. His main complaint was his ankle. For the last 6 years, he had an ulcer on his ankle. And when I finished fixing his heart, I told him, we have a way to solve that.
For the 6 years, I have been not doing the things that I would have liked to do. Golf has been one of my main things that I like to do, and I'm back on it now. And for the first time, I've experienced no pain. There's no doubt that Dr. Carter has really enhanced my life, has actually put me back on happy days again.
All right, that'll do it. That'll wrap up another episode of Top Docs of Houston, the show that features some of the best doctors in the Houston area helping change people's lives. If you want to watch more life-changing stories, just like you've seen on today's broadcast, and find one of the best doctors in the Houston area, go to the website. It's topdocsofhouston.com.
And of course, you can always send us an email if you have a comment or a question possibly for one of our doctors at info@topdocsofhouston.com.
So long, everyone. We'll see you next week.